So good afternoon, everyone. Thank you for joining us. I am Amanda Nelson, Long-Term Services and Supports Manager with the Office of Aging and Disability Services. The purpose of today's forum is to provide updates on the Quest VBP initiative, including upcoming methodology changes planned for calendar years 2026 and 2027. Quest, or Quality Excellence Staffing and Teamwork, is an initiative where Maine DHHS, Maine Healthcare Association, and Maine's Long-Term Care Ombudsman Program have joined forces to integrate value-based purchasing with collaborative educational activities to support you all in your nursing facilities as you strive to make meaningful quality improvements. We're excited to welcome you all today to today's call and encourage you, if you haven't already done so, to add your name and the nursing facility you represent into the chat. This VBP forum is outside of the regular series of monthly Quest calls, so we'll not be offering certificates of attendance today for licensed administrators. This meeting is being recorded. The recording, as well as the slides, will be posted to our Rate Reform website, which Chelsea will drop into the chat in case you don't already have it. The materials will also be posted to the Quest SharePoint site and will be distributed to Quest members via email. If you're not already getting those emails, you feel free to sign up at odes.nifquality@maine.gov. Our presenter today is Olivia Alford, Deputy Director of Policy and Programs with the Office of Maine Care Services. Please feel free, as she's presenting, to raise your virtual hand with the React button at the bottom of your screen, or you can add your questions to the chat, and Olivia will pause to answer them as we go through the slides today. If you're joining by phone, you can press *9 to raise or lower your hand, and *6 to unmute or mute your line. Without further ado, I'll turn it over to Olivia Alford.
Thanks, Amanda. Am I showing the right screen?
Yes, it looks great.
Okay. Good afternoon, everyone. Thanks for being here today. Really excited to dig into the details here with you all. Some of you may have been part of past conversations about this really exciting effort that we've been on together to include value-based performance payments within a nursing facility reimbursement reform effort, in addition to not just payment, but also supporting that through collaborative change making with our partners through the Quest initiative. This presentation today is going to be pretty specific to the value-based components of the reimbursement methodology, going over an explanation, in some cases a reiteration of past shared materials specific to the value-based purchasing parts of nursing facility rate reform, which have already started. We're already in year 1 of this. We are going to start though with year 1 and go through what does value-based purchasing look like for 2026, 2027, and then years afterwards. The reason we're having this refresh of a forum here today is because there have been some tweaks to the design, particularly as we look forward, and we wanted to have a public forum to announce those changes. You'll see though at the end that this is all going to be part of a MaineCare rulemaking, and so this is just a transparency step in advance of that, so you know what to expect with the MaineCare rulemaking that will put these additional future changes into place. But overall, it's very similar to what was shared through the broader nursing facility rate reform efforts last fall and since that time through our various webinars. So nothing big changing here, but there are some improvements we think that are really based on the feedback that we've received over the course of the last 10 months in doing this work with you all and with various national experts, and just in thinking about timelines. So spoiler alert, nothing big, but will be worth your time to learn more about the details of this and get a refresher. I can't see the hands up anymore, but I am going to pause periodically through the presentation to take questions. Okay, So again, some of this might be some things you already know, but we're going to start from the basics. So there are really two value-based components to nursing facility rate reform. There's the quality bonus pool, and there are performance withholds. We're going to describe each of those. There are also just three performance measures that we're talking about when we talk about performance within this framework. We're talking about three performance measures: percent staff turnover, antipsychotic use, and the CoreQ satisfaction survey. And we'll talk a little bit, at least about the CoreQ as one of the more new measures to main. So just to define what we mean by the quality bonus pool, that is when we're saying that today, we're talking about the additional $8.1 million fund that was appropriated through the Nursing Facility Transition Fund in the legislature to support high quality care. And that fund is really going to be available at this point only in calendar year 2025, 26, and 27. It's a 3-year quality bonus pool of $8.1 million each year. The requirements and the accountability in order for a nursing facility to access those funds changes each of those 3 years, and we'll go over those requirements. This fund is dispersed annually, so there's one time a year that we will assess nursing facilities that are eligible for these funds and disperse the funding once per year. The performance withholds are a separate element of a value-based payment. This is where, starting next year, a portion of the nursing facilities, the routine and direct care rates will be withheld to incent continued quality achievement on the 3 performance measures that we just shared. This percent, or this performance withhold, also changes over time. It ramps up. There's a phased-in accountability for all of this. And this performance withhold construct is quarterly. So you'll be talking about this one in terms of quarterly turnaround of data and performance monitoring for performance withholds. I realized I didn't really go over an overview of the other 2 measures here. So the other 2 measures that I'm not going to go over today, percent staff turnover and antipsychotic use, are on the Care Compare tool. They're commonly understood in this field within nursing facilities, so we can always answer further questions about those if you have them. But what we wanted to do today was also just go in a little bit more detail to remind people where we landed with the CoreQ satisfaction survey. So that's something that will be new to some facilities. Some facilities are already doing this satisfaction survey, but it's certainly new that we're going to include the results of that survey as part of a performance payment model. So as a reminder of where we landed, because this has changed over time, nursing facilities will select their own CoreQ vendors. We will be requiring and scoring both resident and family surveys. We will allow phone, text, mail, or email service administration. We are generally following the measure stewards specifications around the CoreQ satisfaction survey, but there's been specific conversation about allowing members in hospice level of care and state guardians that are involved in the resident's life to complete those respective surveys. We've talked about that in the more detailed Quest calls. We are requiring 20 surveys to be received for both the family and the resident populations, and that there's a 30% response rate achieved. Again, that aligns with some of the steward recommendations. What we're getting into today in more detail is how there are reasons why we will also appreciate and not penalize nurse facilities that are smaller, who don't have 30 eligible residents or 30 eligible families to complete this survey in the first place. They can still be part of this value-based payment model, and they can still receive disbursements as long as they do achieve a 30% response rate for whichever number of eligible residents or families that they have available. So, we're starting to get into the weeds here, and I appreciate this is all pretty detailed, but we'll go through it some more later today. We are going to allow facilities to offer 2 windows of data collection throughout the year to achieve these response rates and these number of surveys returned. And we will be kind of delaying just a little bit further the timeline for when all 2026 CoreQ surveys must be completed. We anticipate it'll be late 2026, but we don't have an exact date to share today for when you'll want to have your first round of CoreQ satisfaction surveys completed in 2026. But it is going to be late as possible 2026, where we would be looking to score those first round of CoreQ surveys. Yep.
Yeah, I just wanted to bring up a question in the chat around CoreQ, and if anyone else has others, please chime in. I know there's been seeking a lot of clarification on this. So Maureen Carland asks, can you clarify, you are requiring residents and families, not just residents and families, if the resident does not meet the CoreQ requirements?
I think I'm gonna have to take that one back. I think I'll need to understand if you can jot that, unless Amanda, you know the answer. I'm having trouble translating what that means.
Yep, sure. It might have been my intonation too. So there's just clarification asked, are we requiring both resident and family surveys? It sounds like some facilities in the past, when they've implemented this, they've only surveyed families if the resident is unable to participate.
Hi,
Whereas-
Amanda and Olivia, I'm sorry, it's Mo Carland. I guess I did, it was my understanding that it was a resident survey and that only people who scored below a certain BIMS or above a certain MMSE would then, or a legal guardian would then defer to the family. So am I hearing you say that you're expecting that there is a full resident survey and a full family survey?
Yeah, that was my understanding. Again, I guess I want to go back to the measure specifications to see if there's a reason why certain families would or wouldn't be included. That's not, Amanda, do you know offhand whether there is an exclusion?
I think I know the conversations that were had with the developers, Dr. Nick Castle and Dr. Lindsay Schwartz. And that is just that the families and the residents share different perspectives. It's a different survey ultimately. So the eligible family members and the eligible residents would be surveyed. And to your point, Mo, yes, the folks with a BIMS of 7 or lower are part of the exclusion criteria. They wouldn't be surveyed, but their family members or representatives or state guardians would be, as long as they're involved with the patient resident.
Yeah, so, and if there's any further, so yes, essentially that we are looking for both. There may be additional, we're not going through all the exclusion factors on either side today in the call, but but we are looking for the two populations in this work. Teresa?
In regards to that, I have gone round and round with question and answer with ODES, and their response was yes, you have to get 30 residents and 30 family members.
Yes, that is correct. So 30, you need, so let me, to be scored on this, you'll want to have 20 surveys back from both families and residents. So you want to receive 20 surveys back, and you from that needs to reflect a 30% response rate of who you had eligible to complete the survey. There are facilities who won't have, small facilities who won't potentially have 30 eligible residents or 30 eligible families in the first place. And that's where we're creating a pathway for them to still not lose out on funding because of their small numbers.
Okay, so the reaching out to families is only after you've reached out to the resident, or the resident's unable to answer for themselves, or you're reaching out to both the families of the residents, and then what if the resident does not have family?
If the resident doesn't have what?
Family.
Oh yeah, so right, so there's basically two different populations. I think we can follow up though. This is, I mean, I think I want to consult the specification guide, which I don't have. It might be clearer if we use the same language that they're using. But essentially, there's two populations that are going to be outreached, and and it doesn't need to be a match. So there could be a resident who's in the resident population and a family who's in the family population, and they don't need to have a 1-for-1 match for the same, unit across both of those. They can be different populations that are eligible to complete each of their surveys. So some residents will be excluded, some residents won't have family. That's okay. They can still be reflected in their specific population. But this is a good takeaway. We'll follow up with just some materials to help clarify this in writing using the language of the CoreQ manual, because I think that'll be helpful for consistency's sake. Okay, I'm gonna move forward because we're still in the basic outline here. So the basic outline of what I just said is that, look at it for each year. Year 1, 2025, there was no withhold, but there is an $8.1 million quality bonus pool. Year 2, same quality bonus pool, but there is a 1% withhold being introduced. Year 3, the withhold ramps up a little bit to be a variable between 1% and 2%, depending on your facility, which we'll talk about more. We do not have, as I mentioned, just to reiterate, the $8.1 million, there's no appropriation to continue that fund past year 3 at this point. So the quality bonus structure will look different in year 4 onward. Okay, so just year 1, where we are right now, 2025. This is almost done, right? So we've been already done most of the work for year 1. There were 3 requirements that needed to be completed by the due dates in the main care rule in 2025 in order for a nursing facility to be eligible to get a portion of that $8.1 million. By June, the nurse facility had to identify a staff quality champion. By October, the nursing facility needed to have a representative participating in at least 7, by October 1, needed to have participated in at least 7 hours of the Quest initiative. By October 1, the nursing facility needed to have attended a technical assistance session with Maine Statewide Health Information Exchange, Health InfoNet. Those 3 criteria needed to have been met. At this point, we're past the October dates. The department is now calculating the quality bonus pool payments based on which facilities met those requirements, because we are dispersing the $8.1 million among the facilities that met the requirements only, and then within that by Medicaid bed day share of those facilities. So we are expecting that these payments will be out the door before the end of the year. When we get to that point, each nursing facility will receive notice of what their payment amount is, the justification, or how we got there, and information about how to identify this payment in the remittance advice. So your facility can identify that this was the payment associated with this quality bonus pool. Also, what happened in 2025, nursing facilities started to receive their scorecards. They've been receiving them every quarter since April on the 2 currently available performance measures, the ones that come down from Care Compare. And you've seen what the benchmarks are for measuring quality performance. Your performance didn't change, didn't have an impact on your payments this year in any way. It was informational, start to get familiar with what the benchmarks are. And what we are proposing now is that we will be using the information that we have on these past scorecards to exempt facilities who have demonstrated good performance in the future. So this is one of those tweaks. We are seeing that there's an option now with the scorecards having been produced that we could use that information to say that facilities who have been doing well don't even need to have a withhold in the first place, starting in 2026 for that year. And we'll talk more about that, but that is in response to some of the feedback that facilities have shared. Yep, Amanda.
Yeah, I just wanted to pause as there's a few questions in the chat. Next up, we have a question from Olga. Hi, Olga. Are there any statistics if all facilities responded / met requirements?
Like what is the statistics being like what are the number of Medicaid bed days for
Olga, are you just asking how many nursing facilities this year made the cut for the participation requirements?
Yes, would like to know if everybody was able to respond and participate, or if there were some facilities that missed the submission deadlines. Thank you.
You're welcome. Thank you for clarifying.
Yeah,
do
I mean,
you-
I think we could say the vast majority completed all requirements. I think that's we're still reviewing the documentation. I mean, I think we want to share, talk more about that. I'll make sure everyone internally knows the exact numbers, but it looks like the vast majority did. Is that how you would characterize it, Amanda?
Yes. Yeah, the vast majority met those requirements, and many thanks to Maine Healthcare Association for being so proactive and reaching out to the ones that were in jeopardy of not meeting those requirements, as well as some folks on the Quest team. So very proactive in making sure that they knew what was required. They just weren't able to meet them, and yeah, but it was very few. The next question in the chat: how will you know if your nursing facility qualified?
Yeah, so you'll be getting notice probably in let's see, probably in November that you are eligible or you qualified, and what that payment amount will be, and then how to identify that payment when it comes through, because it'll come through as a separate payment, apart from your regular claims. So you'll get all that information, I would anticipate, in November.
Okay, thank you. The next question in the chat, and Rick, you might need to clarify some of the acronyms, but I'll do my best. Does this only include FFS, main care days, or hospice and DWP? I assume that's days awaiting placement excluded.
It's based on the payer source, the payer of the member. It comes through, the occupancy report comes through based on just the person's primary care.
The question on just the fee for service Medicaid, it's only the main care days that you're getting paid on. There's also like hospice under Medicaid or days waiting placement. Are you going to use those days to pay out the distribution?
That's a good question. Let me take that one back, just because I'm thinking about the different ways.
And a second part to that question, what about specialty care days, the ABI, the behavioral, the vets?
Yeah, my understanding is those days are all in there, but I just want to confirm because just of the way that data is labeled, I want to be sure. So I will get back to you on that.
Okay, thank you.
That's all the questions for the moment, Olivia, but everybody keep them coming if you've got more questions that come up.
Yeah, this will help us design that communication about what these payments are in the coming weeks. So generally, you'll hear this presentation talk about scoring data. So again, we weren't scoring your data in 2025, but going forward, we will be actually looking at performance. How would you perform on the 3 performance measures? And all the performance measures will follow the same framework here, where we will talk about meeting a minimum threshold of performance. The minimum threshold is being defined as the 20th percentile nationally. All of these performance measures have national data sources, so we're able to say, what is the 20th percentile nationally? That's the minimum that we're going to be talking about today. There is also something called the high achiever threshold, which will be the higher of the national or state median, 50th percentile, when that's available for certain measures. And that's where, if a nursing facility achieves that threshold, you're talking about getting into a category of potentially receiving additional funds above and beyond what you would receive if you only met the minimum or were just below, in between the minimum and the high achiever. So those are really the two kind of thresholds that you'll want to think about: minimum and then being a high achiever.
Question with regards to the 3 performance measures, is the scoring going to be applied in aggregate? You're going to, or will each individual measure create a distribution?
Each individual measure.
So it will establish I mean, everything's got to get a rate, and then you will do a distribution on each quality measure, yet you'll identify the 3 quality measures on what the center will be receiving.
Yes, but let me go through the next slides because you'll see how that we get to that point over time. It's not, let me get to that point. It's a little bit complicated because it changes year by year. So let me walk through each year and that's part of this explanation today. So year 2, so we're gonna move into year 2 and start to get into some of the scoring. So when it comes to the withholds will be a standard 1% across nursing facilities, which won't begin until MaineCare adopts the rule that puts these in place. So we had thought that, this might happen in January. It's clearly not going to happen in January. It may be closer to July. So the MaineCare rule timeline will dictate when we'll start to withhold the 1% from nursing facilities for this purpose. However, like I mentioned, there will be an exemption. We're proposing that there will be an exemption for nursing facilities that have scored above that minimum threshold for the past 3 scorecards that we produced in 2025. So for the measures that are on the scorecards in 2025. That is the proposal we're putting out there. That's what's going to go into the rule. That's what we're going to ask the federal government for approval to do. Through the state level rulemaking process, we're going to propose this. That will enable the withhold to only really go into place for facilities that have not met the minimum on the measures that have been produced so far. Withholds are paid back each quarter if the nursing facility meets the minimum threshold on 2 of the 3 measures. So this gets into some of the conversation that I was just deferring on. Some of this is all or nothing. So in this context, the withhold amount, the 1%, is not split up into each measure. It's a 1%. And you only get the 1% back if you meet the minimum threshold on 2 of the 3 measures. And any funds that a nurse facility doesn't earn back are going to be put into the quality bonus pool to reward high achievers. That might not happen. Everyone might meet the minimum and then all the withholds will be paid back. And then there would be no additional funds put into the quality bonus pool. That's TBD based on performance. One question that has come up, is what happens if data is missing on a performance measure? And we went through a lot of conversation on this, and I'm sure there will be continued conversation. But in general, what we're working with as a premise here is that we don't want to penalize nursing facilities for missing data when it's warranted, when DHS deems that it's an allowable or appropriate reason why the data is missing. So some examples could be that the nursing facility is just too small to have data measured on the specific measure. It could be that the nurse facility is a new facility, and so we don't want the withholds to be held back when the nursing facility is just too new for the data to be populated. An example of how I shared earlier with CoreQ is while that we will allow essentially a nurse facility to have missing data for CoreQ if they're just too small to reach the 20 return surveys, but they still went through the process and had a 30% response rate on their eligible populations. So we're going to define kind of the criteria that will allow a nurse facility to have missing data that doesn't penalize them in any way regarding the withhold and in most cases the quality bonus pool as well. So just, this may be, again, very much in the weeds, but just to know that we'll be thinking through how this kind of situation impacts scores and payments. Any questions on that, Amanda?
Can I
Yep.
ask, how do you define eligible residents?
For core Q?
Yes.
Yeah, I'm gonna defer, unless Amanda, I mean, I don't know if anyone has the manual up, because there's a whole bunch of
That's the answer
criteria,
is
which
the
makes.
manual.
What was that?
Yeah, the manual determines who's eligible, Rick, and who's not, both for families and for residents. There's just the one caveat that Olivia shared earlier, that she's making more residents and families eligible than what is in the manual. But other than that, it will be on the manual. Like it specifically says to exclude hospice residents. And we received comments from nursing facilities saying, well, we think that they should be included. Their opinions are valuable too. A lot of my, population is hospice residents. So the determination was made to include them. Otherwise, yeah, it's pretty close. It's pretty right on track with the manual.
The core Q manual.
Yeah.
Yeah. But all of this will be out in guidance as well. So I mean, there'll be the main care rule. There will be I think there's already links out there, and I'm sure we can, if you don't have the manual, we can provide the manual link. But we'll be helping facilities through understanding this, and if a facility qualifies for this exclusion because they don't have 30 eligible residents or 30 eligible families, they'll be completing a form back to us to tell us that they qualify under this exclusion. So all of this will be worked out in a process with us. But the best thing right now is to just look at the core Q manual to understand the requirements.
And that link is in the chat now for anybody who's interested. It's also on the Quest SharePoint site.
Thank you. All right, so in 2026, the quality bonus pool is still, again, $8.1 million, plus if there were any withhold funds that were not earned back available at that time. And this is where in 2026, we're actually not dispersing the money based on individual measures. In this year, you must meet the minimum threshold in 2 of the 3 measures to receive the quality bonus pool funds. And we'll just disperse the funds again based on those Medicaid bed days among the facilities that are eligible. So among the facilities that did meet 2 of the 3 measures minimum performance. If we'll go through some examples next, because we are trying to also make sure it's clear that if you have a valid reason that data is missing, that doesn't mean you're not going to qualify for the quality bonus pool because of that valid data reason. But you would need to have, for the measures that you do have data for, you would need to have, at least one of those be above the minimum. So this is more, again, another kind of all or nothing type disbursement of the quality bonus pool. So some examples might help. So in example 1 here, the nursing facility scored above the minimum on all the measures in 2025 on their scorecards. But their performance was below the minimum. They just had a big dip. I don't know what happened. They had a big dip throughout 2026 on 2 of the measures. So because they scored so well in 2025, they actually would be exempt from the withholds in 2026 because we make that assessment based on past performance. But with this performance being below the minimum on 2 measures, they're not going to qualify for the quality bonus pool in 2026. It's a simplified example, but that could happen. Another example 2, is that the nursing facility has been steadily improving. They were below the minimum in 2025 on the 2 measures, but now they are above the minimum in 2026 on those 2 care compare measures. They completed the core Q surveys with the required response rate, but they didn't achieve the minimum number of responses for residents. They didn't achieve the 20 surveys there, but because they were a small facility, I should have added that here, that in this example, they're a small facility and they didn't have the 30 eligible members, but they did try and they did achieve a 30% response rate. So they will be subject to the withhold because of their past performance, but they still will qualify for the quality bonus pool, even though that in this case their core Q data is missing it's not complete. They did qualify for the core Q exemption.
Does anybody have any questions while we're here related to those examples? I don't see anything in the chat, Olivia. You're all welcome to come off mute and ask your questions too, if it's easier. No, this is a little complex.
And I'll move on. I do, yeah, again, recognize this is complex in a way, and part of that is because of the design to make the accountability and the requirements kind of phased in over time. So part of the transition fund is to kind of transition us to a more stable state, and so that means each year is a little different. The withhold in 2027, so I'm moving forward to 2027. They're really the same premise as 2026, except a few things. There will be, nurse facilities will be subject to either a 1% or a 2% withhold. The 1% withhold will be for nursing facilities that have a medium to high main care and main veterans home 70%, it's called the 70% program, occupancy. They'll receive the 1% withhold. The 2% withhold will be on facilities that have a lower main care or main veterans home program occupancy. The exemptions for withholds will be based on the previous calendar year, so that'll be 2026 data. And you have to meet the minimum quality on all the measures to receive that withhold back in 2027. But it's still quarterly. The operations of it are the same, but we're looking for the minimum quality on all 3 measures by this time. The quality bonus pool is also similar, but just like the withholds, it's changed what we're scoring on. So in 2027, a nurse facility must meet the minimum on all the measures to receive the quality bonus pool funds. But at this point, to Rick's previous question, we'll start to disperse the money based on performance on those specific measures. So half the fund will be paid out based on performance on staff turnover, where we're weighting that measure more heavily in terms of performance and the dollars associated with it. And the core Q and the antipsychotic use will be worth 25% of the total $8.1 million in how we pay out those funds. Nursing facilities that surpass the higher achievement threshold will get a larger portion of the funds within those buckets as well. So this is really the time when you want to make sure you're meeting the minimum on all the measures. If you do have a valid data reason, it'll still apply, that we won't be penalizing facilities for having a valid or warranted data, a reason that their data is missing or can't be computed. There's still that awareness to that reality carries through this time period as well. The example here is really getting to that missing data part. Their facility has had missing data since the beginning for a warranted reason, but it's above the minimum on the other 2 measures. So missing data means that you aren't going to qualify for an exemption from the withhold. You're going to have the withhold because we only are going to bypass the withhold for people who have actually passed the minimum. But this facility could still earn back the withhold and qualify for the quality bonus pool since they have a warranted reason for their data missing and they are above the minimum on the other 2 measures in 2027. Okay, so I'm gonna go through year 4. This one's a little bit complicated. I'm not gonna spend a lot of time on it because of just all the things that are swirling around in our heads. but just to illustrate a little bit about year four forward, we begin to ramp up the withholds, but still treating more favorably nurse facilities with high main care utilization, or this includes the Maine Veterans Home, the 70% program. We're still going to have less money withheld for programs that have that higher main care utilization. This, as you may remember, main care utilization was part of the previous nurse facility rate methodology, and this is one of the ways that we've carried forward the incentives for high main care utilization, and acknowledging that the Maine Veterans Home program, the 70% program, is an important element for coverage for people as opposed to main care. So that as well is kind of baked into this proposal. What's different here, though, is that there's no longer this $8.1 million quality bonus pool. The middle pink row talks about really the high achiever quality bonus pool is just funded through unearned withhold payments, if there are any. So if there are facilities who don't earn back their withhold, that money is going to be redistributed only to high achievers within this framework for year 4 onward. One thing I want to close with on this part is I have been talking about it's really important to meet the minimum. That is very true, but it's really also in your best interest to really make sure that if you have data missing, it's not in your best interest to have data missing. You want to make sure that if you have a reason why your data is not being calculated, your PBJ data is getting rejected by CareCompare, by CMS, you want to resolve those issues, because I think it's really the most reward comes from facilities who have data that's successfully being submitted for all these different elements, and obviously that they meet the minimum when they do have scoreable data. Anything on that, Amanda?
The scorecard is taken from CMS. So how is it missing? Peter, I assume you're talking about how is there suppressed data?
Yeah, how is the data missing? If we get it on the scorecard, it comes from CMS. How is the data missing for some facilities?
Yeah, so I'll give you the most, can I do that one, Olivia?
Yeah.
I'll give you the most common example, and it's nursing staff turnover. Sometimes the facility missed the reporting deadline. Other times they had a PBJ audit that, whatever Myers and Stauffer did, they didn't pass the PBJ audit. So that's when turnover gets suppressed. So there's just no turnover score listed, and then they give a little reason code for why. Another example is new facilities. A brand new facility doesn't have enough cumulative data over 6 quarters for them to calculate turnover. So that would be a different reason code.
$20 because I thought it was Claire's friend dropping them off for me. No, Claire still has my donuts. So these are yours.
Are you asking a question, Travis? Okay, got it. Peter, does that make sense, and does that answer your question? Oh, you're muted.
Yes, it does. I was just curious how people were missing data. I know, like on some quality measures, there's not enough data in a particular time frame that sometimes occurs, but I haven't seen that on my data like for a while. So I was just curious how it happened.
Well, knock wood.
Yeah.
Good job at knock on wood.
Every day.
Keep up with the good reporting.
So you should definitely be, so that's good for your facility. Some facilities do have issues where their data is not flowing through. CareCompare is getting suppressed for various reasons. Some of the reasons are not going to be, like, we are not going to accept all, we can see the suppression reason, because like Amanda said, there's a footnote to why the data isn't flowing through CareCompare, and not all those reasons are going to be accepted by DHHS as valid reasons for data. Like if you just didn't submit it, like we're not going to give credit for people who just, for facilities that just didn't submit it. That's not happening today, I don't think. But just to give an example, there's reasons why that will be accepted for suppressed data, and there will be reasons why we wouldn't accept suppressed data. And in the CoreQ example, for we will accept that a small facility tried and didn't achieve the full number of residents, but we wouldn't accept that a facility that was, had the eligible people just didn't meet the response rate or didn't try to do the survey at all. So, there'll be criteria essentially for when the suppressed data will be accepted.
So UTIs on the scorecard are not considered one of the data items that we're going to be monitoring or a part of the measurement at this point. Because you talked about 2 out of 3, and I'm assuming the 2 out of 3 are core Q, antipsychotics, and staff turnover. There's also on there long-term residents who have a UTI. Is that a score that's being eliminated from the consideration?
Yeah, so the UTI measure has only been a monitoring measure. It's
Okay.
never been one that we propose to score. And so
Okay.
at this point, it's just informational, important, but not scored.
Appreciate that. Thank you.
So the best next steps, other than, checking your data, make sure you have data, and then make sure you understand if you don't, and making sure you know what the minimums are and how far your facility really needs to go to reach the minimum. I mean, again, many facilities are doing well, but there's obviously variation. That'll be the good next step for facilities. For all parties here, the next concrete step will be to review the main care rule when it's proposed to make sure that the rule language is clear. It'll, more formally articulate what I shared today. And you can review that and submit comments if you have any at that time. That'll be the window to do public comment related to what I have shared. You'll want to stay tuned for those notifications of your year 1 quality bonus pool award letters, and how to identify those payments when they come through later this year. And you'll, want to continue to attend Quest calls, and engage with the department and the partners about supporting the work, so you can make sure that, we still, that you have success in the performance measures, and in your own facility for what you're looking to achieve. Those are really what we've identified as next steps. And that is, I think, the end of the presentation today. But I will pause one more time to see if there's any more clarifying questions that you want to go over right now. Yeah, Angela.
Thanks, Olivia. Thanks for the presentation. You mentioned in your last slide that centers should be looking for their award letter. I think you said sometime in November, most likely. Do you anticipate that the year 1 VBP payment will be made in December, like before the end of the calendar year? Is that the goal?
That is the goal. Yep. We have a few payment processes that we have to get through, from federal to state payments going out the door. But that is what we're working towards, and we'll definitely keep you, Angela, and everyone, but we'll specifically, update with you all on our progress on that, so you can get the message out.
Great. Thank you.
Any other questions at all before we close out? Okay, well, with that, thank you all for coming. You all had great questions, and we do appreciate that. After this call, if you have any other questions related to Quest, you can send them to oads.nfquality@maine.gov. Today's recording and slides will be posted to the Rate Reform website and also to the SharePoint by early next week. Today's slides and recording will also be sent via email to all Quest members, and our team will be sure to include another copy of the Core Q manual. We'll send that out again too. I would like to thank you all again for joining us, and have a wonderful afternoon. Thank you so much.